Patients are actually paying for blood, 500,000 shillings.
We bypass the policies so that we cover up the gaps.
You have chintu kidogo 10,000.
There are some months where we don't have enough medicine. We tell them to go and buy.
There is nothing to work with.
Patients have to make payments for things that they are ordinarily not supposed to be paying for because they're supposed to be supplied free of charge by the government of Uganda.
Corruption. They tell them to go and buy or to give the health workers money.
Selling drugs.
We lost a life of a woman in Miana Hospital. The healthcare workers asked for money.
I was the one who was in charge of receiving and signing. There are drugs which were left with only 1 week to expire. I refused to receive those drugs. The MOS was called and intimidated, and he was told to receive the drugs expired. There is a lot of corruption.
Let us send to Kuwait to home side. Nenkwata sente nembawo. Tebatesa kumwana musai paka sawa zino.
When they are asked to pay for blood, around 200 to 250.
Ona statu wange.
Anje sitatu okuyitira munasaba sente.
Ekintu yana bademba gabe.
Kati bakuwayiriza abantu.
Surprise wango ezisabitiza.
Bakusabye sente beka. As if tachuliranga kwe.
You pay 250,000, right?
If they can afford.
If they can.
In Uganda, healthcare is free of charge in public hospitals. But is it? There are various allegations of doctors illegally asking patients to pay for what should be free services, health workers refusing to save lives before getting a payment, and patients losing their lives. My name is Lutaaya. I'm an investigative journalist, and today we are hot on the trail of this dirty money, this blood money. It is 10 a.m. and we just arrived at Miana Main Hospital, the largest hospital in the district, but also serving surrounding districts. This hospital provides a range of healthcare services, including outpatient care, inpatient care, maternity services, surgical procedures, laboratory services, and emergency care. The antenatal ward is fully packed. Today, all the expectant mothers here will receive adequate treatment, but not for long. Maria Grace Nasanga, the midwife in charge here, says in a few weeks they will have no medicines to give them and they will have to buy.
We've just got to this one last month.
From April to September, she says, they had absolutely no medicine to give these expectant mothers.
There are some months where we don't have enough medicine. When we give them a medicine and it gets over, then we start prescribing for them to go and buy from around pharmacies. So we can't know whether they buy them or they don't. Every time they complain about money.
The mothers here will unfortunately end up downstairs in the maternity ward. They will, however, have to part with a lot of money if they are to undergo a cesarean section surgery to deliver, as the health workers here tell us that they do not have antibiotics to treat mothers who deliver via C-section. They will have to buy these medicines.
Wano kusaawe nekisinga okuba obubi ennyo ze antibiotics, eddagala erikozesebwa abakyala okubajjanjaba nga balongoosebwa. Eryo lyo ate lyatuwe zo zaggwaawo. Kiba kitegeeza nti omukyala yenna bw'aba alongoosebwa buli kimu aba alina kugula buguzi.
Miana performs 220 C-sections per month. In the hospital's laboratory, patients must pay for their own supplies. Overwhelmed by the workload, complain about understaffing. Tebuseke Mustafa, a laboratory technician, has been on night
eddagala
duty,
lyennyini
but we find
erijanjaba
him
abakyala
still
especially
working
abakyala
by midday.
abalongoose
Tired
bamaze
and
okulongoosebwa balina
fatigued,
okufuna eddagala
but he must
lyetubakozesa okulaba
continue.
nti ebiwundu ebyo
There is
binyigibwa
simply
bulungi nnyo
no one
kati eddagala
to
eryo
take
liggwawo
over.
mangu n'ewuzi zennyini ze tukozesa mu theatre okulaba nti abakyala balongoosebwa ebintu bye tukozesa generally bigenda ne bituggwako mangu supplies tugifuna bulungi nnyo naye biggwawo mangu kati ne tutandikira okutambulira mu mbeera ey'okuba nti eyebbulwa kati nekireeta ze tuyita delays okugayaala kati omukyala agenda najja mwemwagala mulongoosa naye ate kwegamba ne mwesanga nga ebikozesebwa tebimala nga balwadde balina okutuyambako okugamba nti agule kino kyagula kino tukirina kino tukirina kati bwe muwandikira nti genda okigule ne weesanga nti olw'okuba embeera y'abantu baffe si nnungi nnyo balwawo okubireeta kati ne tubeeraawo nga gwe ekyokola okimanyi naye nga ebikozesebwa tobikola ki.
To better understand the issue of lack of drugs in this hospital, we visit the drug store only to be met by empty shelves.
This is where they put the most used. What are some of those medicines that are most used?
It's mainly antimalarials, antibiotics of different types, painkillers, drugs for these chronic diseases, hypertension, diabetes, things like gloves, syringes, gauze, strapping, plaster.
Just as Sister Aiga revealed, the hospital has 0 antibiotics in store. In the hospital's laboratory, the staff, overwhelmed by the workload, complain about understaffing. Tebuseke Mustafa, a laboratory technician, has been on night duty, but we find him still working by midday. Tired and fatigued, but he must continue. There is simply no one to take over.
I work night and I'm still here. You get? So we bypass the policies so that we cover up the gaps. So you are forced to work overtime.
Asking money from these patients, but it was there before, it was too much. But we had to raise up as leaders. You had to say, now let us put tags on the uniform of this hospital, of these nurses, the doctors working in the hospital. We have even a case where a lady in Kalangalo, somebody took money because of these tags on their uniforms. We managed to trace the person and we managed even to get the money back. Right now, at least we have created a situation whereby we are working as a team, the political wing, political team, the technical staffs, the doctors inside the hospital, the MS, the hospital administrator, to say at least we identify those individuals. And whenever we get to them, the cases are always forwarded direct to police. It has reduced, but before, let's say, where they used to ask, let's say, 100,000, as now you can see, if you go deep in patients, you can hear that at least now, even though you have Chintu Chidogo 10,000.
Miana woman MP Joyce Bagara says this is a gender-based violence issue, as mothers are now dying because they lack money to buy medicines in government hospitals that are meant to be free.
When mothers continue to die while giving birth, it is a violation of the rights of women. You know, if a mother is sure that she will go to a health center and give birth to a healthy baby and also live a healthy life, they'll go and give birth and contribute to the GDP. If they're not sure about that, they'll be afraid to even give birth. And I think it's a human rights matter that should be addressed.
While here, an accident victim comes into the emergency ward. He's bleeding on the face. Health workers refuse to touch him, not even for first aid, because they do not have gloves. His family has been sent to buy these gloves, and it is only after the gloves get here that he will get any medical attention. The situation is not any better in the wards. The hospital has oxygen cylinders, but the men's ward only has 1 oxygen cylinder head. While we were here, This one-cylinder head was being used.
Kalabe nze kenyina keeko kamu naye kalabe tukasibirira kaleme kuyisa tusibirira sibirira nte kati bakedde kumpa ku makya ebadde bintu teri ku bulibooti concentrator ze tuyina amasannyalaze gajaaminzi mu soketi tegalimu
Kiza bw'obaana abalwadde babiri nga bonna beetaaga oxygen
awo wabeera obwo
tosobola bakolako
buli gy'ogenda okusaba naffe eriko omuntu kati n'obeera awo nebikusobera abalwadde bonna bonna batunuulira gwe kati nogaaka kati ngenda kukola oxygen heads bannaayo
waliwo abajjira ddala nga talinamu yadde ekikulu
bebasinga mulala najja ng'aliko baatendanti naye nga buli kyemubagamba kino kyekigenda okuyamba omulwadde ng'agamba kati tulina wadde n'ekikumi mu mutu we tumuzeeyo ewaka kati bwe baleeta ekinene nnyo tuyinza kumalayo wiikisi 3 abasajja kale generali babeera babiwunda okusinga kate ebino ne biyingirira awo boozi bw'ogenda mu sitoowa mutono ne bakuwayo piisa anoga audio nalina kumpi yabiwunda kunyonyola n'akitegeera nagamba musawo nkitegeeze naye siina ssente
kati
saawa zino mbeera neetaaga iv metronendazo oba okukibuuti iv ceftriaxone iv ampiclox ebyagulisi bwe bibeerawo kubanga ebyo gavumenti bebeera ebireese bibiri nekati
saawa zino ebyo tebiriwo. From the people who are in Miana main hospital, they tell us that the supplies of medicines rarely reach places that are as far away as this, and so patients have to make payments for things that they are ordinarily not supposed to be paying for because they're supposed to be supplied free of charge by the government of Uganda.
At this health center, the district health officer calls them and refuses us to film anything, ordering the health workers not to speak to us. They, however, also decry the drug stockouts, which they say have rendered them powerless in the face of their patients. Walter Fred, a former member of the hospital board, says they sometimes receive drugs they have not requested for, and other times the drugs are close to expiry.
I was the one who was in charge of receiving and signing for the consignment of drugs that were being delivered at the hospital. They did send 60% of the drugs which we had requisitioned for. 40% we didn't know who actually ordered for such drugs. And when they got here, there are drugs which we did find, or which I did find, which were left with only 1 week to expire. And those which actually Ministry of Health had condemned. I refused to receive those drugs. Even the MS came and said, you know what? We didn't order for these drugs. We agreed to take the drugs back. Before the driver driving for around 20 kilometers, the MS was called and intimidated. And he told that, you know what? We called from Kampala. He didn't exactly reveal to me what exactly called him. But he got a call and he was told to receive the drugs expired. I tried to talk to him, but he said, you know what, for the good of my job, I'm going to receive the drugs. And I told him, please, I will not sign. And that's where the problem came in. That's how my signature was flagged off.
We are heading to Mayuge district. We've received the tip-off that there's a health facility, a public health facility that is making patients pay for blood transfusions. Now we know that blood transfusions are actually free of charge, and the blood is actually donated by Ugandans through donation drives, but these patients at this health center are being forced to pay for these blood transfusion services. And we've also, in the tip, we've also learned that maternity ward is making patients pay money in a public hospital to get the maternity services, to get deliveries. They're paying for C-sections. This tip has also been shared with the Inspectorate of Government, the office that is meant to investigate corruption in Uganda. And we've been told that the IGG may visit this hospital today.
In Mayuge, we find this little girl with her family by her side. She is fighting for her life. Her father says the hospital has extorted him for money to give her a blood transfusion.
Betutuuse kumacha ne batugamba tewali musayi. Batugamba omusayi tegule ogutya. Ne bagamba leta sente tukuweeki tukuwa omusayi. Ne nkwata sente nembawa emitwalo 5.
By the time we get here, she has still not received this blood.
Tebateese ku mwana musayi paka saawa zino.
You people ask for money, 50,000, to buy the blood. You've had? You've had.
Then when they returned the money, when we were here.
First of all, they paid, but still they didn't give the blood.
When pinned about the issue, the health workers who allegedly asked this father for money a few hours back vehemently deny ever asking for money.
Ne mama no saba sente.
Ona start wange.
Ate sitatu ogoyitira munasaba sente.
Ekintu yana bademba gambe. Even if you take an interview.
Baba kulonga tujja kubanga tuba tumanyi tusabiriza abantu sente.
Because of that, era surprise bango ezisabiriza.
Nedda ne bezibeera oba bweziri oba teziri omusaba. Ne mukama agenda bwocho. Is there blood in the store? Wino uno. Bakusabye sente meka? As if tachuuliranga kwe.
When they are asked to pay for blood, it is when the blood in our banks is over.
There is a child who needs blood.
Yes.
And he has not got blood.
Yes.
But there is blood in the laboratory.
That one I can only
How do you
confirm
explain that?
That one I can only confirm when I ask with the lab people and the people on the ward.
We find out that the hospital even charges more for cesarean section deliveries.
Since we've operated, which is not feasible. So at times we organize and we ask them for some money. They solicit for money for some of these supplies when they are out of stock.
How much?
Around 200 to 250.
You pay 250,000, right?
If they can afford.
If they can afford.
If they
can't,
we refer them to Ginger.
Okay.
By a stroke of sheer luck, this little girl happened to fall sick on the day that a top government official, the IGG, was coming for a visit. The blood, which the doctors here had earlier sworn was not available, is quickly found, and she receives a transfusion for free. She is then quickly referred to Ginger Regional Referral Hospital. Today, her ambulance ride too is free of charge. Executive Director of the Center for Health, Human Rights and Development, Fatia Chiange, says blood money has become the norm in many hospitals and health centers in Uganda.
I know my relatives who paid 500,000 shillings last week for blood in a healthcare facility in Kawempe, which I will not name today, but I'm sure they will be accountable to that. My uncle passed away.
Chiange says this is a great problem that is causing deaths in Uganda.
We do not know of any factories and any industries where actually blood is manufactured. Blood is donated by us, the communities. So it is definitely unfair for anyone to pay for blood. But we do have healthcare facilities where patients are asked to pay for blood. And we know that blood is a life-saving commodity, especially for women and girls who are delivering. If we do not deal with this situation where women have to pay for maternity services, especially in public health facilities, we may not be able to reach our targets. Of course, we are doing well in institutional deliveries, in maternal health mortality ratio, we are improving, but we can do better if we are able to prevent the illegal and unethical payments, especially when it comes to basic healthcare services like maternal health. The teenage pregnancies, if you look deeper, most of them are happening to the most vulnerable girls in the country. Those who cannot actually pay for anything. They cannot pay for any maternal health services. So in a situation where women have to pay anything, even if it's just gloves for maternal health services in a public health care facility, it disadvantages especially the most vulnerable. You know, there is a series of problems and challenges that come out of that. You increase your maternal mortality ratio, you increase chances of losing the babies. So I definitely think, yes, we are doing well when it comes to especially maternal health services, but the issue of asking for money, asking women for money, asking families for money is an issue that can make us stagnate where we are.
In 2001, President Yoweri Museveni abolished user fees in public hospitals, thus making healthcare totally free of charge in Uganda. According to the official health policy, one is meant to come into the hospital and leave without paying a coin. Unfortunately, some are buying medicines, others are paying directly to doctors, and those who cannot do it are losing their lives.